have been building up implementation services over the past year and helping pharmacy owners implement point of care testing in their practice, which has been so rewarding, getting to travel all over the country and help independent pharmacy owners who are struggling. And many of you have, came from independent pharmacy, or you might be independent pharmacy owners yourself. So you understand, you have struggles with staffing, you have struggles with, DIR fees, PBMs, like how are you making revenue? So one of the things I do is I go into a pharmacy and I set it up, it's white glove, start to finish. So we go through like, what does it mean to be a CLIA lab? How do you go from, seeing walk-in patients to taking appointments? These services are not going anywhere. If you're thinking about, creating your own independent pharmacy, even, to do your PGX testing, which I know there's been other pharmacists in the academy that have done that, get into point of care testing. Find a small office space where you can get licensed with the state board, or, better yet, just, create a small, office space for your business and partner with a lab. I mean, there's so many opportunities out there for pharmacists, and it doesn't have to be, you have to have $1 million+ to create these businesses, which we all know. I mean, that's why you're all here. You can do it very, frugally, very cheaply, and still see patients, help them out, and be a part of their success. Like, how do you give patients access to care?
Right.
That's really what people are wanting. Hey, I had COVID, I got really sick, what can I do to prevent this in the future? So I'm like, okay, let's run your DNA through the nutrigenomic test and see what, you might be lacking or what you might need more of. And then the people that really did have a lot of medications, I'm like, hey, you might benefit from a full on, PGX test. And then people who were like interested in gut health. So I have gut health packages as well, which as a pharmacist, you can sign up with, Wellevate, and you can order labs. So you can order labs for cash. You can do them on yourself. You can send them to patients, and they have the functional medicine labs, and then they have the regular labs. There's like 3,000 something in there. So I find that it's actually cheaper to do that than to send people, to go get that and then get it billed on their insurance. So I can still kind of, see people from a distance. I can either drop ship them a test, or, have them go to their closest lab and get that done, and just, continue to follow up. So, and people love that service because they don't have to get in a car to come see me. And people are so used to Zoom. Patients of all ages now have been, accustomed to Zoom. Even my patients that are 80 years old will still jump on a Zoom call with me. So, there's so many opportunities to, provide testing services beyond PGX in your home. You don't have to set up with a physician to do chronic care management. You don't have to set up with a physician to do remote patient monitoring. You don't need that at all if you're not billing through Medicaid, Medicare. The big thing is that you let the, physician know that you are doing this, that you are seeing their patient. And if you need anything changed, that you have that conversation with them. In a way, we all kind of practice chronic care management in pharmacy. We have patients that come in every single month, and they want to know like how you can help them. And how many of y'all have sat down with patients and done 30+ minute consults over their disease state, what's bothering them and what changes they can make. And you've all done it for free. So there is a much, much better way of doing. People see, my clients, they see the value in it, and they do have access to me. They can text me, they can call me during, normal hours if they have questions. And, they love the service because they feel like they're finally getting the benefit. And I'll tell them, I'm like, hey, you have a physician visit coming up. Talk to them about this. Here's the list of things I want you to talk to them about your medications, about the problems you're having. Don't forget that.
Right.
So, there's so many opportunities. And then to create the relationship with that physician too, that, hey, I'm helping your patient. I'm seeing your patient. I'm not stepping on your toes. I'm not changing their medications. I'm not doing anything crazy. I'm just working on them, one-on-one. And then they start referring you patients, because I've had many physicians go, oh, hey, my patients, they just love you and they want more of you. So, can you see this person too? They're in need of some help. So, and that gives you that opportunity to go to that physician, give them business cards, have that conversation. So, so don't ever discount that, you can do these things online, you can do them from your home and still, make your rounds and go see physicians. The great thing too is that in most states, technicians can do a lot of this work. The pharmacist just needs to be the one to call and report it. But you're empowering your technicians now. And that means that they're going to want to stay and they're not going to get so burnt out on, filling prescriptions. They're like actually getting to interact with the patient and they feel like they're very valued. And of course, pharmacists are going to learn how to do it as well. And they're going to be the expert and they're going to be the ones who are going to be teaching it. So a lot of, my pharmacies that I go in and I implement these services, they're like, this is what pharmacy is about. This is what we should be doing. We shouldn't be just counting medications. We should be actually feeling like we're helping people. And, same thing for PGX, they feel like they're actually helping a patient and doing good instead of just, handing out another pill. And this is the future. This isn't going away. This is going to surpass vaccines in pharmacy one day, pretty soon, next couple of years. It's going to be point of care testing. And, if you're not jumping on it now, you definitely should be, so you can establish yourself in the community as that thought leader.